Welcome, everyone. Welcome. My name is Jo Comerford. I have the honor of serving the 24 cities and towns of the exquisite Hampshire, Franklin, Worcester district in the Massachusetts State Senate. And I am delighted and honored to welcome you tonight to this People's Town Hall. This gathering tonight is one part report back from me and our team about the work we're doing, and one part dialogue where I really hope that together we both look at what's right in front of us in terms of this session, this legislative session. It's the 191st session, and where we want to go in this COVID world, this post-COVID world, as we approach the end of this year-long pandemic and economic crisis. How do we together build back stronger, more equitably, with the well-being of everyone in our beautiful district in mind? So there are instructions on how to access closed captioning in the chat. Just click on the chat icon. That's the little thing that looks like a speech bubble at the bottom of your screen, which will open the chat window. I'm going to review the instructions verbally as well. I'm so grateful to Caitlin Morey, who's with us tonight from Total Caption, as well as Aliston Castillo Rosenblatt and Nicholas Magnolia, who are both with us from Just Words Co-op and are doing the simultaneous interpretation. And thanks to Caitlin, this event has English closed captions. To access the English closed captions in Zoom, a banner is going to appear indicating closed captions are available. So click on the CC, that's closed caption, button on the bottom right side of your Zoom screen and click Show Subtitles. Again, click on the CC button on the bottom right screen of the Zoom screen and click on Show Subtitles. You can adjust the size of the captions by, again, clicking the CC button and opening the menu and select subtitle settings. So you can make them smaller or bigger based on your preference. You can also view the captions in a browser window separate from Zoom if you prefer, by typing the following URL into your browser. And it's also going to be in the chat, so you can just click right there. It's bit.ly/Comerford Town Hall. And again, that's in the chat for you. You can adjust the view settings from the menu options at the top of that window. So examples of settings you can adjust are font sizes or background, text colors, font type. Again, this is all in the name of making this meeting as accessible as possible. Thanks so much to both Allison and Nicholas. Again, we have simultaneous Spanish language interpretation. Okay, now this is the big thing. Because we are making this accessible to everyone in tonight's Zoom hall, that's everyone, English and Spanish speakers alike, have to select a language preference, either English or Spanish. And that's something for all of us to do right now. In your Zoom meeting, and that's again on the bar at the bottom of your Zoom, click Interpretation. Okay, follow me here. Click Interpretation. Then click the language you would like to participate in, either English or Spanish. Okay, if you have any problem at all, you have to chat Cameron on our team. Cameron's here to help you. We will get it sorted out and you will be able to participate. So in order to reduce feedback and noise, we've muted folks for now, and we'll ask that you keep yourself muted until the question and answer portion. And I'm going to review that process before we open up the questions. But first, I wanted to show you a slideshow that we put together for you to help talk about the kind of work that we've been doing on your behalf. So just give me a moment. I'm going to share my screen and take you through a slideshow, and then we'll open it up for your questions and your answers and your feedback and our future visioning that we'll share together. Okay. So here it is, friends. Again, warm welcome. We are very, very grateful to all of you for joining, very grateful for the closed captioning work the interpretation work, and very grateful that our region's community cable television stations, really the heartbeat of our local community, are with us tonight and broadcasting live. So this is our team. I want to warmly welcome District Director Elena Cohen, Chief of Staff Jared Friedman, Sam Hopper, who's the Director of Constituent Engagement, Cameron Lease, our Legislative Aide, and Brian Rossman, our Legislative Director. And let me just say, while I love this beautiful group of humans a great deal, and I'm very grateful for their service, let me say up top that Sam Hopper deserves our thanks for this evening's town hall and all of her wrangling. And this is our district, friends. If you've seen this before, it's because sometimes we go back to it to show you the kind of unbelievable, really unparalleled kind of engagement our district has. So on the left of your screen, you can see 24 cities and towns up along the beautiful Connecticut River. But on the right of your screen, you can see your power. This is your power. You are unbelievably engaged. In fact, because we keep pretty significant records, we believe that about 64,000 of you have contacted us between now and back into January 2019. 64 individual constituent contacts on issues that matter to you, that matter to your families, that matter to your cities and towns, that matter to Western Massachusetts. And this is us all joining together for the well-being of our people, for the well-being of our communities, for the well-being of our region, for regional equity. That's the kind of unparalleled engagement you see right there in that map. And we in our team believe that we're as strong as all of you combined. So the different colors represent different things. Sometimes they represent groups, sometimes they represent individuals, sometimes they represent that you've called or sent a letter or sent an email or called us out on social media. That's all important. It lets us know what you're thinking and how we can serve you better. This is a little bit about our work. We're not going to go in here in as great a depth as we went in December. Remember, we just reported back to you in December, and we did a much larger and deeper dive into the kind of granular work we're doing. But let me just say very, very quickly that we think of our work in these budgets. So in terms of municipal and constituent work, let me just give you a few numbers. We have resolved, that means we've opened and closed on behalf of constituents successfully about 1,050 constituent cases since we took office, and that's back in January 15. Our numbers in terms of constituent cases during COVID have quadrupled. We are currently serving 125 people in the Hampshire, Franklin, Worcester district. And sometimes it's a sort of a pesky thing with the RMV. Sometimes it's an issue of healthcare. Sometimes it's an issue of unemployment or eviction or a really pretty significant issue with a court case. And so I just want to say that Cameron, Elena, and Sam and our team who do this work get up in the morning and every day work for the people of our district. We also work for municipalities, and that can look different too. That can look like getting a grant. That can look like trying to resolve an issue with a state agency that's not seeing it the way the town believes it should be seen. And thanks to Elena, we've opened and closed 85 issues with municipalities, again, in our first session as we enter our second session. In terms of legislation, we've filed 57 bills. We're going to spend some time on them, and 14 home rules. Home rules are when towns ask us to file an important piece of legislation that the town wants. And then we work with our House partners to get that done. And we've also co-sponsored 485 bills. We co-sponsor things because we think they're important, and we'll show you a couple of them at the end, but we really co-sponsor things because you think they're important. You tell us what's important. And so we monitor your email campaigns, your call-in campaigns that tell us to look at a bill and give it a look and see if it makes sense. And so we do that work on your behalf. And when we co-sponsor, that means we do things to fight for the bill, just like we're doing for our own bills. We also have in our own committee bills, and we're going to talk a little bit about the committees that we're in now, we have 397 of those bills. So those are also under our leadership and care. So between the bills we filed and the home rules and the bills we co-sponsor and the committee bills, we really are full in terms of our legislative platform that we're working on this session. And of course, I would be remiss if I didn't mention money. Our job is to bring money home, and that's home to the people, home to the community, home to the programs that work here on behalf of our people, and also statewide priorities. And you're going to hear a little bit about our statewide priorities and where we've been able to make some gains in a little bit. And that, of course, is all part of both budgets, annual budgets, like the one that's moving through right now, or supplemental budgets, like the ones that move through all the time, or bond bills. They're all up for grabs for us. Okay, this is a quick look, and it's probably too busy a screen, honestly, but I'll say what it is very quickly. These are the committees that I'm serving on in your name this session. And I want to point out that I'm serving on 2 committees as chair. So the Joint Committee on COVID-19 and Emergency Management and Preparedness, and also the Joint Committee on Public Health. I'm also the vice chair of the Joint Committee on Higher Education. And that's, of course, that's a no-brainer, right? We have GCC and HCC and the University of Massachusetts and an array of important state colleges and universities. So it's an honor to return as Senate Vice Chair. And it's an honor to go back to public health. I loved public health and I loved getting appointed, and I was so honored to do it. And then the pandemic came and that work became so much more important. We held an oversight hearing for COVID-19 back more than a year ago now, March 5th, I believe. And it was because we saw this a pandemic approaching and we wanted to do something about it. We wanted to make sure the legislature and the state was ready. And from that time, the Senate president appointed me to lead the Senate's COVID work, and I've been laser focused with my team. And that is now manifesting both continued commitment to public health and this new committee where we are more of a watchdog for our future preparedness in this vein, again, that we're in tonight together of building back better on all of our behalf. Okay. So I'm going to run us through our bills. We call these bills to meet the moment. We see them as bridges into the world that we're entering. Again, in this, as we approach a post-COVID world, we wanted to see what we could offer in terms of legislative proposals that would build us back better, stronger, more equitable, how we could take the unbelievable energy of our constituencies, people like you tonight, and put it to work in terms of meaningful legislation. So I'm not going to be able to talk about every bill, and it's going to be a little heartbreaking, but I want to get to you. I want to hear from you. So I'm just going to tell you about one bill in each category, roughly, or on each slide. And then the team is going to put in the chat the bills to meet the moment summary, and you can click through that right to a summary, right to the bill itself, if you want more information. Okay, we're starting here with criminal justice. And I want to highlight a bill that is essentially no new prisons and jails. This bill, and I have a column about it coming out in the Gazette, this bill really represents for me a full circle of work and interest in criminal justice. Right now in the Commonwealth since 2011, our prison census has declined by 29%. At the same time, our spending has risen by 25%. And Families with Justice is Healing, which is an organization by and for women, women of color, women who have been incarcerated, women who are family members of folks who are currently incarcerated. They said no more focus on new construction, put any kind of state money into alternatives to incarceration or post-incarceration support services. And that's the value proposition I got behind when I agreed to file this essential bill. Under disability rights, there is a bill to protect the homes of deceased Mass Health members. And let me say, this is a story that began with a constituent who reached out. They had a family member who died. It was an untimely death. And all of a sudden, in the midst of their mourning, the state came calling for a repayment of mass health fees. And so we did some digging. And of course, we went to work on behalf of this incredible family. And we found out that Massachusetts has one of the most egregious, what is called estate recovery laws or protocols in the nation. And we said, no way, that's not fair. So right now, if you're on Mass Health, which is our Medicaid program, and you're older than 55 and you're receiving Mass Health services, the state can what's called recover the cost of those services. And 90% of the families who have this happen to them have to sell the family home in order to recover those services. And so we filed the bill last session. We made some gains. We went to bat, we went toe to toe with the administration, made some gains, but it wasn't enough. And so we're back this session with the help of folks like you. Let's get into oh, I think I might have missed a slide. Yep. Okay. Sorry about that, everybody. Let's get into education reform. Now, there's a lot we can say about education reform. The Student Opportunity Act during last session really offered what is generational investment, much needed, long awaited investment into our K through 12 education, public education, and that is amazing. And we are at it this session to both advance the Student Opportunity Act and to deal with a decline in enrollment during COVID and to further a deeper conversation on special education. All of that is essential. What we're also doing, however, is we're saying around MCAS, which I'm going to narrate here again. And if you're joining, I'm only doing one bill per screen just because we want to get to your questions and comments. What we're doing in this bill is we're saying two things. One, Massachusetts has to get with the rest of the nation mostly and say that one test, this MCAS test, cannot determine whether a student has a diploma or a certificate of attendance. Right now, all you have to do is fail one MCAS test, English or math or one of the sciences, and you are threatened with not getting a diploma. You get a certificate of attendance instead. That will not allow you to advance the way a diploma, high school diploma would. So we're saying that we can determine competency of students without that one test. Many states do it. In fact, we've done it 3 years running during COVID. And so we can do it here in Massachusetts. We have to stop taking diplomas away from kids who have otherwise passed their requisite coursework. We have to allow them to go on to a future, and however they determine it. And wouldn't you know that kids of color, immigrant kids, special education, kids on IEPs, kids with English language who are new to the English language, they are disproportionately represented in the cohorts of kids not getting a diploma. So we're saying no more with that. And we're also saying, let us rethink how we define excellence. Yes, we have to test. It's part of our requirement. If we want federal funds, no one's disputing that. No educator is disputing that. But let's think about how we determine excellence in the Commonwealth. Let's think about what we can do, where we can go if we really want to have an opportunity to rethink this test called MCAS. We're also saying we have to reinvest in higher education. This is an act called the Cherish Act, and you can see the act name right below. And this says basically, we have disinvested in public higher education. That's places, again, like GCC and HCC and the University of Massachusetts. We've disinvested 31% per student, 31% per student since 2011. We've disinvested, and we're saying no more. Public higher education is the bedrock of certainly of our economy here, but it's also the bedrock of our Commonwealth. The vast majority of kids who go through public higher education, they remain in the Commonwealth, unlike private institutions. They give back, they take what they learned and they put it to work in our communities to make us stronger and more resilient. So we're saying we have to go to bat for them. And this, of course, would help with the student debt crisis. It would help with the adjunct faculty crisis, I will say, where institutions are relying more and more on adjuncts. It would help strengthen a sector that we need. Now, this was important before COVID, but now during COVID, as we come out of COVID, the kind of economic recovery we're going to need, the kind of economic recovery grounded in the kind of 21st century jobs that we know we need for our climate bill to succeed, they're going to be found in our public higher education. So let's fund it. Now we'll turn for a moment just to foster care. And here's an act to strengthen foster care. And again, I filed this last session before a boy named David Almond lost his life while he was in foster care. And in the wake of that tragedy, this bill has only grown more important. Currently, in Massachusetts, our Department of Children and Families conducts its own review of its own work. And this says, no, we have to establish an outside foster care review office to help strengthen the state's commitment to the 10,000 or so children in the state's custody. And we believe that it's kind of a lift all boats approach so that the system will grow stronger, foster parents will be strengthened, and the children will have the kind of care that they need and deserve. So let me pause here just on energy and environment. There are three issues really: healthcare, education, and energy and environment that really are the bedrock issues, and I know for most of you. And we made some great gains in this in the last session, right? We passed the Next Gen Climate Bill, and we passed it and passed it and passed it because we had to keep overriding the governor's vetoes, but we did it. And it really was a very profound and good people-powered victory. In that, thanks to Amherst, we have a net zero building construction provision, right? So we're going to see that manifest. We have our team put in, I think, a very important amendment in terms of sequestration, where we inject into the bill the acknowledgement that sequestration has to be part of the climate solution. Also, in last session, we passed a bill that we filed called Healthy Soils, and that's going to help farmers sequester greater amounts of carbon in their soil. Many in our region do that anyway, because that's the best practice, and they're climate conscious. But this will help that practice grow throughout the Commonwealth. But that wasn't enough for us, and so you'll see that we filed a suite of bills on energy and the environment, and this is just one on PFAS. PFAS chemicals, it's a class of chemicals. There are thousands of them. They are exceedingly toxic. The understanding currently that if you have 1 part per million, that's 1 part too many. They're known carcinogens, they're known neurotoxins. They've also been found to actually reduce the efficacy of vaccines. They are in so many things. They're in car seats, they're in rugs, they're in fabric, they're in upholstery, and we have to get them out. So last year in public health, we heard a number of PFAS bills, we passed them forward. This year, we're helping to lead the work to rid the Commonwealth of PFAS. And coming soon, this is a little teaser, and here I really want to call out and thank Jared Friedman for this. Jared has been leading an exploration of legislation to mitigate against development pressures on farmland and forests in an effort to achieve what we're calling no net loss. This is coming soon. It is a massive bill, and we wanted to do it right. So we didn't file it on February 19th, which is when all bills had to be filed in terms of core session, but we filed late files. They're called late files all throughout the last session, as many colleagues do. So you can expect to see a no net loss bill in the future. And while we're on the subject of farms, let me just say that farmers, the agriculture economy, it's like a heartbeat in our region, right? It's intrinsic to us. It's what makes us a great deal of what makes us who we are in the Hampshire Franklin Worcester district. And so it's not surprising that you're going to find your senator filing farm bills. And so we're doing everything we can to help farmers stay farmers who want to stay farmers. And so the bottom two bills are about trying to take what is a razor thin margin and make it a little bit bigger by giving farmers a toolbox of things that they can use. But we wanted to actually go further. And so we wanted to say, let us advance also equity in agriculture. Let's look at how to make grants available in equitable measure with a specific focus on communities of color, recognizing that farmers of color are by far underrepresented in our Commonwealth. And so I really want to thank the farmers in our region who talked to me about this and really helped advance this. And I want to shout out especially to CISA for really leading the way on a bill like this. Healthcare. So boy, there's so much to be said about healthcare. And here I want to just talk specifically about the heroes in local public health. Local public health, everyone, the adage is you can't see local public health when it's working. It's there with us all the time, keeping us well. But boy, we did see it during COVID when the strains of the pandemic hit us so hard, and our local public health officials rose day after day to defend us against a virus that really we knew almost nothing about when it hit us. So this recognizes that our 351 cities and towns in the Commonwealth have 351 different ways of working public health out. And this says, let's give everybody the same standards, the same training. Let's make it easier to share knowledge and data, and let's fund it. Let's fund it the way it should be funded. In the Commonwealth, many states fund local public health. We have not. We have not nearly at the level that we can and should. We did during the pandemic. We were able to get $10 million into the budget, last year's budget. We're at it again this year for this year's budget to recognize municipalities and public health officials need resources to do their life-saving work. But we can and should do more than that. And this is a pretty visionary bill. This next in this next bucket of healthcare, the Health Equity at All Levels bill, and this recognizes that the vast majority of money and attention we spend in the Commonwealth on healthcare is really on the medical side, in hospitalizations or more acute care. But in fact, what makes us well and keeps us well are what are called these things called the social determinants of health. Where we build a highway, where we locate an incinerator, where we decide to put educational opportunities, job training opportunities, where we decide to open a clinic. Those are social determinants of health. And so this bill says that all decisions in the Commonwealth have to be made with health equity at the center. So it's a multi-year bill, multi-step bill. It's the first time it's in, but we wanted to show it to you tonight because, again, as we look forward to COVID and the knowledge that we have to build back better with equity at the core, we know that we're going to have to do things that were previously completely, they would have never been considered. Now, in the wake of so much inequity, so much loss, and the chasms exposed for us, we have to take these kind of bold, uncompromising, visionary steps forward to create a new chapter. We also have to allow spouses to serve as caregivers, which is the next bill here. So this is a bill that's been championed by this community. And it's very simple. It just says, if you are receiving mass health as your health care, your spouse, like your sister, like your niece, like your nephew, can actually receive remuneration, can be paid to be your caregiver. This is an unbelievably simple bill. It would strengthen economic security for elderly families. It would allow more people to remain home in the care of someone who loves them best. And it should be an option to elders and to people living with disabilities. That's it. That's what it should happen. And in terms of housing, of course, the area of housing is vast. And I want to shout out to the Network to End Homelessness at Pamela Schwartz, who helps focus us on housing issues. One of the things that we've heard about again and again is the fact that our Commonwealth hasn't invested enough money in affordable housing. And so here's one bill in this vast area that would allow, it's a local option bill. That means localities would have an option to assess a fee on the sale of luxury homes and build affordable housing in the local community. So local money stays local. And it's, again, by assessing a fee on luxury homes. And the luxury homes are many times above the median. Regional development. Now, there's a lot we could say about regional development and our municipalities, but let me just say that we have a fund to build libraries, we have a fund to build schools, but there's nothing to help towns build town halls or rehabilitate town halls or build fire stations or other complexes that are DPW complexes that are needed to maintain the well-being of a town. These are $1 million or $1 million plus projects, and yet we haven't found a way to support them at the state level. And so this idea came from the towns. Many of you may be on this call this evening who shared with us just the frustration about not being able to take on a fire department project or not being able to rehabilitate a buildings to make it healthier for town hall. And we have to help towns do this. This is in addition to federal money, in addition to some of the other kind of reclamation grants that are potentially available to municipalities. We just have to create, again, like libraries and like schools, a fund that municipalities can turn to. So this bill has received actually quite a lot of attention, and we're excited about what could potentially happen as a result of it. Of course, part of this has to come with an acknowledgement that the state can and should do more to raise revenue equitably and fairly. I know this is a value that many of you hold, and so this is a proposal that I have in with a House member that would actually look at capital gains and investment income, which is right now has a reduced percentage on it, and put that back up to something that could be potentially more beneficial for the Commonwealth with that kind of investment. And I want to say thank you to the very many people who have talked to me about this bill. And thank you. I didn't highlight the veterans bills down here, but I should have, as I look at them. I want to say that the women and men serving the nation right now are going to get a boost in the form of the Holyoke Soldiers Home rehabilitation. And thank you to House members who have done that work to really recognize the unbelievable painful loss of during COVID of the people who lost their lives at the Holyoke Soldiers Home. And that's one part of the service and what we owe people, but we also owe the Veterans Services officers. We owe their work to be strengthened, and we owe the ability of the state to recognize and extend retirement benefits buyback options for people coming back in to communities and working in public service. So those are those two bills. And then we have other bills in the democracy and transparency category that just for time, I'm not going to go into in great depth. And I want to just then end in this, this slide. This is another one of those busy slides, but it represents among the 385 bills that we've currently co-sponsored. And here you're going to see a lot of bills that you love, that you told us that you loved. Like the tax on carbon, like the Family Work and Mobility Act, like the Safe Communities Act, like Medicare for All, like preventing evictions and foreclosures. These are bills that my colleagues have led on that I am honored to co-sponsor in your name. So thank you for allowing me this opportunity to share with you this evening about the work of my team and me on behalf of our district. And now what we're going to do is actually, I'm going to stop sharing my screen, and I'm going to take your questions, your feedback, and hopefully your ideas about how we build back better in our districts starting tonight. What do we do as we approach the end of the post-COVID world to make sure that we are stronger, more resilient, more equitable, more prepared to be in service of the people of our beautiful region? So I'm imagining you have questions, and I'm excited for them. So what I'm going to do, or questions or feedback, what I'm going to do is I'm going to talk now about how we're going to get that done. And Sam is going to be a big part of that. So I'm just going down now to the place where I have some notes to share with you. All right. So to ask questions or share an idea, you're going to raise your hand on the Zoom feature, and you're going to find the raise your hand feature. And this is going to depend on which version of Zoom you're using. So for some folks, to use the raise hand feature in the Zoom menu bar, remember that's the one at the bottom, you're going to click the icon labeled reactions. This is going to open your reaction menu, and then you click the button labeled raise your hand. And you can also lower it there as well. For some, for others, you may find the raise hand feature by clicking, again, the Zoom bar menu controls on the bottom, and click on the icon labeled participants. This is going to open the participants window. At the bottom of that window, that's the participants window, it'll open on your right usually. You can look and see how to raise your hand or lower your hand there. If this doesn't work, if neither of these work, you may need to access this feature by clicking the More menu, which usually has 3 dots. If you're joining from a mobile device, you may need to touch your screen to make the menus appear. And if you're on a phone and you're dialing in, you can dial *9. Now, I can't see everybody since there are so many good folks on the call. We're going to have to use this in order to make sure that we can see you. And Sam's going to call on folks and unmute you in the order of when you raised your hands. And she's going to help you unmute. If you're joining by phone, you can unmute yourself by dialing *6. And again, if this doesn't work for you, Cameron, you can chat Cameron in the Zoom, and he is going to help us access this, and Sam and I will also scan the pages. So if you want to wave, we're going to try to get you as well. So with that, I'm going to just warmly invite you to raise your hand, and I see a lot raised, and let's have your questions and feedback.
All right, the first hand I see up is Kathy. Kathy, I unmuted you. You can go ahead and ask your question.
Thank you. My comment was related to specifically post-COVID and maintaining the electronic ability to attend things, not only with you, but state sessions. If I could give evidence to a committee this way without having to drive to Boston, I mean, that makes our part of the state more equivalent to those folks who can take a quick T ride and get to the State House. Of course, this is the issue of people who don't have internet connection is a different one that has to be addressed. But that would be an easy one to, I would think, to implement, since we've already been doing it for the last year.
Kathy, thank you. And thank you for your service to Orange. You are tireless. And yes, part of this is the kind of thing that we have to figure out as we go forward. You put your finger on it right away. How do we charge forward in a way that takes what we learned during COVID, say, for example, with a commitment to public health, or with a commitment to virtual participation, and bring that forward into this new day? It is very much on the radar for me, to keep the efficiencies and ability to participate. Also, frankly, for commissions, right? Right now, if you want to serve on a task force or a commission and you're in Western Massachusetts and the meetings are in the State House, that's hard, right? But we can do that better, and we are doing it right now with the Maternal Health Equity Commission without folks having to drive. So thank you.
Thank you, Kathy. Next person I have is David. David, I've unmuted you.
Thank you. Hi, this is Dave Farrick. I'm from South Deerfield. And thank you, Senator, for having this electronic town hall, a great venue to talk with you and listen to others. First is a comment. The mandatory testing for students is extremely important. We do not need to stop it this year. We need to know where the children are in terms of their performance. It's all been a very unusual year for everybody. But I would think that educators, and certainly myself as a parent, want to know where the kids are in terms of their education and their performance. And if there has been a degradation, how they can do better and catch up in the following years. So I really strongly encourage continuing the testing. The second point I want to bring up is regarding the mask mandates that are currently in effect. And it's really a two-part question. Given the fact that other states are lifting their mandates, number one, when does Massachusetts plan to lift the mask mandate? And two, has there been criteria set by the public health services for when we would lift the mandate?
I love both of these questions. Thank you so much, David, for asking them or sharing your feedback. Let me take the mask and then I'll end with the testing. So we've heard from a lot of folks who are interested in the mask mandate. And as you know, the governor was on he has executive authority, right? Because we're in a state of emergency to make these decisions. He was gradually reopening. I will say that, and you may have heard him say this, there isn't immediate, or at least there wasn't when I heard him say it, immediate intention to further reopen at this point. And I will say that I agree with the governor on that. Again, we don't know exactly what his next step is going to be. As part of my chair's positions at the COVID committee and the public health committee, we did do a hearing on the COVID variants. And we know research now is talking to us about the COVID variants being more contagious and actually more deadly. And we're seeing in other states like Michigan, for example, a significant uptick, and certainly it's taken Europe by storm. And so I do think that there are probably ways we can make the mask mandates more nuanced rather than lift them all together. And we certainly can engage in that. I just want to also say here, though, and I so much appreciate the urgency here, and I can feel it too, in terms of these masks. But I do think that we need to remain vigilant. We're not out of the woods yet with COVID, and we want to keep, especially people who haven't been vaccinated, well. And there are pockets of our Commonwealth, especially in communities of color, where the vaccination rates are woefully low. So I am vigilant on this. I am reading the science. I am talking to HHS, the Health and Human Services Department of Public Health. I'm in constant contact with them because of my positions, and I promise I am going to try to help chart for our constituents the best way forward. On testing, I think, again, I want to make sure that everybody knows I am not in wanting to have an opportunity to rethink MCAS and de-link it from a graduation diploma. It's not that I don't value the efficacy and the need to test. My concern, and I'll just speak frankly to you, was for kids going back to school, and all middle schoolers are going back on Wednesday. My concern was that there's been such learning loss, and there's been so much social emotional loss and some trauma, significant trauma, that I wanted our schools to be able to address these kids on that level before testing them. Right now, my son, for example, is going to have MCAS 2.5 weeks after he goes back to middle school. And that's tough. Now, we've been able to support my son through a lot of this, but he hasn't seen his friends in that same way. And I don't want to go into details too much, but there is a trade-off, I think, for us testing this spring, say, versus testing in the fall, after perhaps summer school programs or other district-wide build back programs, in order for teachers to get the kind of baseline and parents and caregivers to get the kind of baseline. But I hear you, I ache for this too, and what our kids have been through. But that's where I just want you to know where I was on offering MCAS this spring. It will be offered in the Commonwealth. It is not, however, going to determine the graduation for the class of 22. So we can talk about that more if that's interesting to folks. Thank you, David.
Thank you.
Thank you. The next hand I see up is Simon. Simon, you're unmuted.
Thank you. Thank you so much for hosting this and allowing me to have opportunity to talk. I wanted to go back to the topic of foster care. I'm a public defender and I represent parents and children in juvenile court. And I appreciate that the state is making efforts to protect the rights of foster parents, but I wanted to talk about the rights of another group of people impacted that's a little less frequently talked about, and that's the rights of the biological parents themselves. I've seen since beginning my practice here a couple of years ago that parents and children are getting very few opportunities to see each other when they're in foster care. Since COVID started, the Department of Children and Families is often allowing parents and children to see each other one time per month for 1 hour. And this is a pretty standard practice. And it's also pretty disturbing. Under non-COVID situations, it would frequently be 1 hour for one time per week, which I also find to be kind of bizarre and very limited in terms of interaction. I think that it's really inhumane. I think it's far more reasonable and better practice from a social work perspective for children and parents when they're removed because there's something wrong in the home to have contact at least for 2 or 3 times a week, which is frequently done in other states. And one of the reasons that this is happening here in Massachusetts is because under the law, currently, the courts defer to the department when it comes to planning parenting time or visitation between children and parents. So the law under a couple cases, and I'm not necessarily going to bore you with that or everyone else with the details, the courts are required to defer to whatever the department says unless it's an abuse of discretion, which is a very a standard that basically comes from administrative law and is extremely deferential and is unique. It's an outlier in the entire country. There's only approximately 3 states out of 50 that allow the department to decide what the parenting time plan is without a judge having the authority to issue an order for visits that would be in the best interest of the children or the child. So there's a law, if I could just cite it really quickly, it's HD. There's a bill being proposed and it's on the Mass website. If you look at this, I forget what the exact website is, but it's HD 3158. It's an act minimizing trauma for foster children through improved parenting time plans. Currently, when you click on the link for that law, it says being worked on by House Counsel or something to that effect. But it's up there and I would strongly encourage you to support it. I think that as I'll wrap up really quickly here, just one more sentence.
I'm just mindful of so many other people and I want to reply to you.
So I'll be really quick. So I think today when we look back at mass incarceration, we go, how did we let that happen in the 1980s and the 1990s? And at that time, we thought it was normal. I think one day we're going to look back at this time and go, my goodness, how did we let that happen for so many years where children were being removed from their parents and they could only see them for 1 hour a month? Thank you so much for the time.
No, Simon, thank you. I want you to know, actually, I don't know whether you know this. I was a foster mom, my wife and I, and it was a very personal choice. Clearly, parenting is a personal choice. But I want you to know that the act that we filed, actually, and I may not have said this well, and so forgive me if I didn't, but it really is. It has foster parents and kids and the system in mind, but also birth parents. I agree with you that birth parents need to be much more foregrounded in the work that we do in the Commonwealth. And there's a whole bunch of reasons behind a lot of the other legislation that we filed, looking at the social determinants of health, looking at structural racism, structural inequality, economic inequality, and the kind of devolution and bad stuff that happens to people. And that, I mean, certainly we're working on those fronts as well, but this act really would also, we hope, be beneficial to birth parents in the Commonwealth. That's the idea behind it. I hope you take a look at it. And boy, I hope you're in touch because I'd love to talk to you more about this particular piece of that legislation. And certainly we're going to look at your legislation. Probably Cameron's already written it down. And so we'll certainly look at that. But I hope you're in touch. And if you can just send your email in, I'd like to be in touch with you about this bill.
Okay, thank
Very
you.
much. Thank you.
Thank you, Simon. Next up, I have Susan. You're unmuted.
Thank you. Joe, thank you very much for having this town hall, but also thank you for being part of our forum this past March. And just to let you know, we have had over 300 individuals who are involved in this. So we're hoping to really work on affordable housing in a major way here in the region. The question I have is, and I don't know whether it's a law that has to be changed or whether there has to be a change in regulation. But right now, in terms of the Commonwealth assisting in helping develop affordable housing, the emphasis is on larger developments, and larger for they're talking about 30 units, 40 units. Obviously, that doesn't fly here in the Valley. And so what I'm wondering is there a way to be able to make a connection with either DHCD or put together some kind of bill that sets up a new kind of approach for smaller towns where a large development is not going to work and where we need to have bigger subsidies because the developments are smaller? Thank you.
Boy, first of all, thank you for your work. That was an amazing forum that you put together. I was so happy to join. And I love that you're moving this forward like a freight train. So it's just, really, it is unbelievably good work. So the answer to your question, or sort of like the issue you're raising about Western Massachusetts, this one size fits all approach, it doesn't necessarily need to be, I want to say, legislation at all. We have engaged in this conversation that beginning last session, and we are engaged with grantors like DHCD in the fact that these kind of stipulations for these grant programs don't work for us. We need 8 units, not 45. Right? So a community, for elder housing or for family housing, it's not the scale we operate at. And yet we have fixed costs, which is what you're talking about, that need a different kind of scale approach as well. So, we should take this offline too, Susan, and talk about what you're finding, through the rest of your great work. But the answer is yes, we're on it. Yes, it's not just me either. Adam Hines, Ann Goby, and all kinds of wonderful House members understand this issue, but it's the people power that you're muscling that make me hopeful, frankly, that we can make some differences. So I have some ideas that are already percolating after your good question. So maybe just follow this up with an email and let's continue this conversation. It might look like a regional letter or, the beginning of a forum or some sort of briefing in the legislature on the kind of grant programs that would really work for Western Massachusetts, something like that.
Great.
Very good and important idea.
Thank you. Next up, I have Tori. Tori, you're unmuted.
Hi, and thank you so much for having this forum tonight. And I appreciate your work for people with disabilities that you're doing. I am directly affected by the how Mass Health will take someone's house after they've passed away. So at this point, I have decided not to sign up for Mass Health, although I could use it. I'm actually paying out of pocket for help because I have 3 children and my house is what I have to give them after as their inheritance. So how can I and the disability community help move this this bill forward so it happens faster, because I know it can take years and years for things to pass.
That's true. Tori, first of all, I'm going to just type my email here in the chat. if you want to email us separately about your current circumstance, I'm thinking, I'm watching Elena's face, and and Sam and Cameron, and I'm just wondering if there are things that we can do to help you in this moment. So if you want to talk to us separately, these are cases that we field a lot. So just know that your personal situation could come offline into a personal email. In terms of your political help, boy, we need you. If you're on this Zoom, you're now on our mailing list. If you got here by Sam's chuckling. If you got here by Facebook or Twitter, you're on our mailing list now. We will tell you when that bill comes up, and we are going to need an unbelievable amount of political pressure. Again, just the bill itself moved the administration, and now we have to go further. And stories like yours, brutal, are going to be the thing that's going to call Massachusetts conscience forward. Again, we are egregious in this behavior, and we have to do better by our people. And I'm sorry that you're struggling with this.
Thank you.
Thank you. And that's, if you see the chat, that's my email.
Okay.
And please do be in touch.
All right. Thank you very much.
Thank you.
Next up, I have Jane. You're unmuted, Jane.
Hi. I can't see that I'm on, but that's all right.
I can hear you, Jane.
Okay. Well, thank you very much for this open forum. It's wonderful. I'm working in Montague to try to get my town to opt out from the mosquito spraying program where the law changed last year. And I have contacted your office about it separately. First of all, thank you. I know you had a lot to do with amending that law and making it better. So that's fabulous. I'm deeply concerned because I'm working with a group of people from different towns. None of us knew before the end of March that this was going to happen. 5 people firsthand, I can tell you that, myself included, no person in my town knew, not the Board of Health, not the commission, the select board, not the Conservation Commission, not the watershed people. I'm the one who told them. They're not the ones who told us. And that I know is true for 5 towns, and I know secondhand is true for another 5 towns. I know of 20 towns where everyone is scrambling against the deadline because they only heard about it 3 weeks ago. And I know of several towns that have refused their constituents to opt out simply based on the schedule problem. So my first concern is there a way to extend it given the very poor distribution of information that occurred? And secondly, is there any way that your office can do some, I don't know, news blast? Because I'm betting that come May 16th, there's going to be 100 towns in this state that say, what? We're doing what? And that's really bad.
Yeah.
And
so let me
just one more about is another concern is that the law really has no criteria, and the state says we can refuse your opt-out. And I want to know that you will be a watchdog and usher your constituent towns, if we've applied, that we get accepted as opting out, and that you make sure that the state doesn't refuse everyone. If there's no criteria, how can we possibly, there's got to be a way of, if you don't like what we did, then let's improve it together rather than let's be refused. And that's it. Thank you.
No, Jane, and I know that I have a meeting set up with you to go more. So thank you for your advocacy. So, mosquitoes are one of those examples that I use when I think to myself, we just never know what's coming our way as a legislative office. So in the middle of COVID, in the middle of the apex of racial justice uprising in the aftermath of the brutal murder of George Floyd, the governor introduced a bill that came to our committee that basically said, God bless the man, you can spray wherever you want, whenever you want, how much you want, till the end of time, essentially. And we said, what? And the environmentalists said, what? And the town said, what? And clearly Triple E is no joke, and the governor was responding to that. So, and I appreciate the DPH folks, but in fact, we had to do so much better by our people. So Brian, who knew, Brian, I was gonna, we don't have to we call it the bug bill. Brian, we just didn't know enough about mosquitoes, but boy, we learned quickly. And Brian dove so deep into spraying aerial and ground, the different chemicals, the different opportunities for towns. We looked at other communities, and the environmental community was unbelievable. And it was deep work, and we turned around a bill that was much different. As you know, we have a task force, a spraying task force for the 21st century. We're participating robustly in that process. And at the same time, we wanted towns to be able to make their own decisions in this intervening period. I'm sorry to say that the administration did not, even though we asked them to promulgate regulations again and again, the administration did not do this in a timely fashion, nor did they do it in a thorough fashion. And we are left in a sense right now with that aftermath. We are not accepting that aftermath. So you are not the only community that is experiencing significant frustration. We are advocating right now for another cohort of communities. We are going to stay in this. It is important for towns to be able to decide your right direction. We'll talk specifics about your good work offline, but it is, we're going to stay with this all the way through because aerial spraying, as you know very well, for those of you on it or leading municipalities, mitigating for mosquitoes has potentially vast impacts. And in the southeastern part of the state, where there's much, much more spraying, the aerial spraying that was used was in containers that were laden with PFAS. And so for a little bit after we passed the legislation, again, that was much different, we thought that the spray itself had PFAS in it. It didn't, as it turns out, but the containers that contained it did. And now this PFAS that I was talking about, 1 part per million is deadly or beyond deadly. That we've been spraying it as a Commonwealth across communities. And so that's the potential risk we take when we don't fully consider what's happening as we aerial spray. So we're in it, and we're going to stay a watchdog, and no town will ever feel, while we're in office, no town's going to feel like there isn't someone there raising a fuss on their behalf and trying to move the needle. Thanks for raising it.
Thank you.
Jane, I know Senator Comerford looks forward to discussing further when the two of you talk. And I just want to add that we did absolutely blast out notice of the opportunity to opt out to every municipality as soon as it was promulgated, although it was promulgated too late.
Okay, thank you.
Thanks, Jared. Yeah, Elena sent it out, but again, it came out very late. And that's part of the problem.
Thank you. We have a lot of hands up, so I'm going to move on to Wendy. Oh, hold on. I'm sorry. Just a second. Okay, Wendy, now you're unmuted.
Hi, I'm not there. I am. First of all, thank you so much just for doing this and for all that you do. It's just, I'm amazed at how much you hold and how much you move forward, Jo, with your staff and your team. I just want to, it's not a proposal. I just want to highlight again the struggle that we have in Western Mass with access to recreational water and our really sensitive rivers and what's going on. And we've got local communities trying to manage it, but there's really, these small towns need support from the state. We can't, small towns can't afford the kind of patrolling and caring that's going on with people coming in from all over to use our gorgeous, gorgeous rivers and overloving them and risking people on the road. So there's an effort moving forward, and I just want to make sure that you're aware and wondering if there is anything that's happening at the state level on this to be able to have water sources that everyone can go and enjoy without threatening the pristine nature of what we have here.
I'm so glad you're raising this. It's so important, and I'm grateful to Mass Rivers Alliance and to folks like you, frankly. We have unbelievable natural beauty out here in Western Massachusetts. So this is a vast topic. Let me just say that I am, and my team is incredibly engaged in terms of supporting the budget line items that give DCR and other EEA, and I don't want to use all these acronyms, the energy and environment and natural resources folks, the people power necessary to do the programming, to make the repairs, to build the access ramps, all of that stuff. That's part of the work that we always prioritize because of where we are. There are other very important bills. I also want to say thank you to the Connecticut River Conservancy. So Mass Rivers and Connecticut River Conservancy are essential. We're supporting all of the priority bills of these organizations because they are enacting some of the policy change. And let me just say quickly that of particular interest to me has been the Connecticut River. It's the nation's first ever blue highway, for goodness sake. It's just a massively important river to indigenous communities, to environmentalists, to people who want to access the natural resources, to farmers. And so really, our office has taken on a commitment to bringing state focus and resources to the Connecticut. We did a day-long paddle down the Connecticut that left my arms like rubber, but we're doing it again, and maybe we're going to expand it. We're talking to the secretary now, Secretary Theo Herides, about expanding it, maybe joining hands with Vermont and Connecticut, maybe recognizing the regional, the New England wide, and thank you to All Out Adventures for making this kind of dream phase possible as we recommit to this kind of getting people on the water to focus on what's needed.
So thank you. And I'll say that we're working with the Green River Watershed Alliance in Vermont, and they're looking at breaking the border and coming south.
That's it.
Deerfield River, there's the Charlemont, there's what's going on in Charlemont.
Yes.
And it's about being able to get into the river. So I'm wondering if, as you're working on the Connecticut, we can look at places where people could actually have river access, where the banks aren't as sensitive as the banks on the tributaries are.
Yeah,
It's
very
not just
smart.
getting out on boats, it's being able to get in.
Of course, no, and having it be accessible
Yeah.
to everyone, right?
Yes.
There's an accessibility issue that we're really watching as well. So you don't have to have a lot of money to get out on the river. The river should be a common good that runs through us. Thank you so much. Thank you.
Thank you. Next, I have Rory. You're unmuted.
Thank you for access to this forum and for your support of eliminating wrongful foreclosure. The Real Estate Title Protection Act is essential for cleaning up false and fraudulent documents filed in our registries, in which improperly cloud title to Massachusetts residents' homes, even if borrowers make every payment on time and in full. MAPLE, the Mass Alliance Against Predatory Lending, is also sponsoring a suite of bills in addition to REDPA. Taken together, they're a comprehensive approach to rectifying the damage that out-of-state banks have done to the Commonwealth by, one, predatory mortgage lending on home mortgages intended to be foreclosed, and two, non-judicial foreclosures by sale that have no court oversight and which practically always fail to comply with Massachusetts law. What I want to ask for is a joint judicial committee oversight hearing on the home mortgage foreclosure crisis to help legislators understand the overall context that lets large out-of-state financial institutions foreclose on and take Massachusetts families' homes and the effects, including more than 400 families per month made homeless, practically all of them illegally. So that's what I'm hoping for.
Rory, first, I just want to thank you for your leadership on this. And I loved our last meeting. I'm glad we're going to support the bill that you've been helping to power forward that we talked about then. I think this is an essential issue. One thing that I just need to say, just in terms of full accountability, is that I'm not on the committee of jurisdiction that would do such an oversight hearing. But when I can and will commit to you right now is following up with you after this public hearing, public town hall, and writing and connecting you with my good colleagues who would be on the communities of jurisdiction to do this kind of oversight hearing, and then certainly supporting any of your efforts as your senator. public health and the COVID committee, they wouldn't be of jurisdiction here. But we certainly can advocate with you. And I will.
Terrific. Thank you so much.
Thank you for your leadership.
Thank you. Next, Dorothy, you're unmuted.
Thank you so much. I'm a member of Safe Tech Northampton and Massachusetts for Safe Technology. And my concern is about the need for towns to have control over the deployment of small cell towers, especially near homes and schools. And 3, 4, and 5G towers is what are being rolled out as we speak. And 5G has especially not been tested for safety on human health and the environment. We're advocating the use of the precautionary principle in installing these towers near residences and schools. Human health, well, our group formed because people are becoming ill in our town when these small cell towers are installed near their homes. So that's how we got started. The towers can also affect property values. They can affect pollinators and birds, the radiation from these towers. But towns can have control by including ordinances and writing ordinances to regulate these towers. There are attorneys who can help with that, which you can find on the Facebook page for Safe Tech Northampton or for Mass for Safe Technology. They have a website.
Thank you. Thank you so much. I do believe that municipalities should be able to determine what gets cited where. That isn't something for the state to decide. And I appreciate you raising this issue very much.
Thank you. I hope you were able to read the info that Kim Weber sent from our group. We appreciate it. I
haven't read it yet. I see Jared shaking his head, which means that it's in a pile for me to read, or a virtual pile. And I will read it. You have my word.
Hi, thank you.
Thank you, Dorothy.
Thank you. Pamela, you're up next and you're unmuted.
Hi, thank you. I'm glad to be here. I have 2 questions for you, Senator. One you may have already answered, because my question was, who do I contact when the governor's trying to open up the state and my city is acting like it wants to stay closed down? I had the person at the mayor's office tell me I didn't understand what a pandemic was. We haven't had a senior center for a good 14 months. The library is now closed still. That's the only 2 places where an elderly or impaired person can access any kind of computer unless they have internet and a computer. You may, it just sounds like people are frightened about the variants. In my building, we have herd immunity, and I want to have a little reprieve from what we've been experiencing, even if a variant is coming down the pike. I will say that my daughter has told me that a variant does not cause anyone who's vaccinated to be hospitalized, and she runs a big hospital in Milford. So I think there's confusing data about what's going on, and that's always a concern of mine. Let
me take this one and then I'll do your second one.
Okay.
First of all, I hear you with wanting to see an end of the COVID restrictions. I want you to know I feel it myself. I do believe that HHS Secretary Mary Lou Sutters is considering all the data as we reopen. Your daughter is correct that currently the variants of concern, which are in the Commonwealth, and that's P1, B17, and B1135, they are protected largely, the ones that we know of right now in the Commonwealth. And right now, I should say to people that more than 30% of the tests being performed for COVID right now are COVID variants. So if we think that COVID variants aren't here, We are mistaken. They are very contagious. But you are correct, your daughter is correct, that the variants of concern that we know about now we are protected in large part from what we understand from current science through the current vaccines, all of them, help mitigate against getting sicker or perhaps ever catching it, right? Nothing's 100% in this world, as everybody knows. And so, but not everybody is fully vaccinated. I am myself, I'm not fully vaccinated. But besides the point, I'm besides the point. There are many people who haven't even had access to one vaccine. And they are disproportionately in poor communities and in communities of color. And we have to be mindful because COVID ravaged communities of color so desperately, disproportionately, that we must be mindful as we reopen not to do disproportionate harm. That is very important. And so that when we're looking at the mandate of opening, we have to look at a full Commonwealth. I want to say that I do know that access to senior centers and libraries, even though they've done like Herculean things to become accessible virtually during COVID, it's not the same as being able to go inside. And I totally know that. And I hope that we are soon going to be on that path to reopening as we get more and more people vaccinated and get to that, and our younger people will be eligible for the vaccine, and we'll be able to get to that place where we can really begin to turn our face toward full reopening. And I do know these services are critical. I really want you to know that.
Thank you. My second question has to do with lobbying. When I was able to get into the State House, and I just heard recently from one of your staffers that who knows whenever it's going to open up. But my concern is, because I'm really pretty politically active and I keep emailing people, I find even when I listen in to something going on in the State House, they're not taking oral comments much at all. And as a matter of fact, they'll say it needs to be written. You need to do it 2 to 3 days before. I found out, I said, oh, I guess I didn't realize and have the time to read the email more closely. So I think because we are in a Zoom mode or remote everything, I think we're paying a price. You know, like if you can't send your written statement and you don't know when it's due, I'm working with Democracy Behind Bars. We're all hustling like crazy about that. Because we got very last minute notice for something that has to happen this Wednesday. And that's just one example. So I feel like, I mean, my basic concern is we're losing a lot of rights. And I understand the pandemic and the virus, but I'm very concerned, you know, about the freedom of speech and the right to assemble and the right to show up and lobby and rally. I drive to Worcester and we rally like crazy in the city of Worcester.
I love your activism. Let me just say that government does not work unless people make it work. Someone said to me once in a meeting up in Franklin County that the State House was like a bottle of cold molasses dripping upside down unless people heat it up, right? I totally believe this. I completely believe it with all my heart. I do know that the Senate has taken great pains to structure rules around engagement. During COVID, the first year of COVID, we did have hearings on things that where sometimes some of the committees, not all of them, but some of them only accepted written testimony. I do agree that limits the participation. The Public Health Committee, we're having a hearing on Monday, and we are accepting verbal testimony. You have to sign up in advance, which also could be a benefit. Kathy Rennig was talking earlier about not having to sort of go back to the old ways. One of the bad old things was you'd get in and you'd have to wait for 4 hours. Now at least you'll get a slot. To sign up, we should do that, right? We can use executive functioning and do some better things for our constituents going forward. But more and more, I think committees you'll see will take verbal testimony, which we must take it. We must make these hearings available for both written and verbal testimony. We must give them more notice. So let me say, if any of you are sharing this frustration that Pamela's just articulated, and you have a bill that you want to understand about, you can do two things. One is you can write that committee directly. All the bills are in committees right now. And so you can write that committee chair, House or Senate, directly. And you can say, when the heck are you going to have a hearing on this bill? And I want to know. Or you can write me and say, hey, Joe, I care about this bill. When's it coming up? And we can track that and get you an answer. So your own vigilance in terms of staying on top of the bills you care about will be very, very helpful as we move through this time. Thank you, Pamela.
Welcome. Thank you.
Next question, Sam.
Thank you. Next is Matthew. You're unmuted.
Senator Comerford, thank you for your time. I'm a student at UMass Amherst who is currently studying health policy, and I have personal experiences in dealing with disabilities. One of my questions is related to one of your bills, or rather two of them. You mentioned one regarding health disparities and reforms and ensuring that those individuals at risk would have some degree of protection, along with one on housing protections. During the pandemic, individuals have struggled with income as a result of losing jobs. And I would be willing to guess very well that individuals who have certain conditions like autism or cerebral palsy have often had a lot of disparities as a result. How do those bills address concerns regarding disparities in their cases as a result of the pandemic? And is there any way that individuals with cases like autism are also able to get equal distribution for potential treatments like the vaccines or monoclonal antibody therapy? Forgive me if I'm not being concise.
Oh no, Matthew, thank you so much. I'm not sure exactly which bills you're referencing, but just let me say that what you're talking about is so important, right? There isn't one bill that's going to be the full solution for what we need this session and going forward. You just put your finger on intersecting issues: housing, income inequality, access to healthcare, equitable response during COVID, and so many more. And you're completely right that that's the role of government. So I think what we should do is, and I think someone, maybe Cameron, can you chat Matthew, if we can? Yep, thumbs up from Cameron, and give him your email address, and we can set up a time for a deeper conversation on this. And I really can understand better the kind of distinct policy proposals you're calling us to. But what you're talking about, the complex intersection of what makes us well and keeps us well, is just right. Thank you.
Thank you. Next up is Violet. You're unmuted.
Hi, my name is Violet and I'm from Pelham Elementary. We are doing a unit on social issues, and we chose to do the roundabout in Northampton. Where do you stand with it exactly?
First of all, everybody right now
Are you
around
with Northampton, or do you think the Native American site should be post-solved?
Sorry, Violet, I cut you off initially because I was so excited. I just wanted to just recognize, Violet, you know, your activism during elementary school. I see Jared clapping. I'm sure there's other claps out there. Thank you. Thank you. You got to start early, holding politicians accountable. So thank you for your unbelievable activism. So this is an issue that has been exceedingly present for my team and I for months and months and months now. And so it's, for folks who don't know, there is a roundabout that was slated for, and it was in development for a very long time in Northampton. And there's an important archaeological find. It's an indigenous archaeological find And so Violet's asking where I stand with this. So Violet, I've been pretty public on this. And if you email us, or if someone finds Violet and gives her my email, I'm happy to send you the list of blog posts and letters and things like that that are and actions our team has taken, because this is super, super important. So where I stand is this. There is a Native American observer. He is a man by the name of Mark Andrews. He is, we've become quite connected to Mark. I believe that Mark and other Native Americans with whom he's engaged have to be at the center of anything that happens. I've said that publicly in writing and verbally. I do believe that. We've told that to Federal Highway, which is part of the situation that's happening because some of the money coming in is federal. We've told that to the Mass Department of Transportation, which would implement this. We've said it to city officials. That's where we are on this. And the Native American concerns have to be addressed as part of this project, as a prerequisite for this project. And I just was on the phone, I think it was Mark with yesterday, maybe the day before, just going over where things are. And it is a clear position. And we've done this work in partnership with Rep. Sabadosa, who also represents Northampton in the House. Thank you for your question.
Thank you. And Chevy, you're unmuted now.
Thank you. Hi, Joe. Chevy from South Hadley, from the land of the Nipmuc and the Tumcuck and the Nonotuck. Anyway, am I coming across okay volume-wise?
You're perfect.
Thank you. The condo association here, 140 units, is putting new roofs on the buildings. And I'm surprised that there are no solar panels. Does the state have a program for larger developments, either a mandate or a recommendation, some sort of tax incentive, or are we waiting for the federal government to take the lead on this, Joe Biden's 30-30 plan or whatever it is?
Oh my God, so first of all, this is a great question. This is an issue that we're working on, actually. The issue is around this thing called the single tax parcel, which has made it very, very difficult for multiple units in the same tax parcel to benefit from solar. It's been a barrier for developers, a barrier for associations, a barrier for co-ops and condos. It's just a sort of like one of those relics that we need to just transform. Right now, only one person in the condo association, for example, could net meter. Net meter is the big state incentive that allows selling energy back to the grid. So we're on this. And I will say again, constituents told us about this. They talked to us about this issue that they were facing, and we had to understand it. And then we worked with this great rep who's no longer in office. He was from out east. And we picked up a bill on the Senate side that he had on the House side. And we're going to go for it. And so that's one piece of what you're talking about. But I do think that if we can crack it, along with other kind of incentives to putting solar on the built environment, different than on a green space, I think those are the two pieces that we are going to work on to help transform projects like the one you're talking about.
Thank you.
So single tax parcel, let's remember that. I didn't talk about the bill, but it's the bill that we have to absolutely nail this session.
Now I have those concept handles to start talking about this a little more intelligently.
Oh, my hand movements, yeah. So we need solar incentives on the built environment, and we need to pass this thing called the single tax parcel. Super duper wonky, but that's energy policy generally.
Joe, that's everyone who had their hand up, but I'm also cognizant we're 15 minutes over.
Well, look how many people stayed, 15 minutes over. Are there any remaining questions? These were fabulous questions, important questions. All right, my friends. I just want to name, if I can, before I close, I want to name and thank again the community television stations who are broadcasting live with us tonight. That's South Hadley Community Television, Greenfield Community Television, Northampton Open Media, Amherst Media, and Athol Orange Community Television. Oh, can you imagine how wonderful they are that they figured out how to join forces and broadcast this tonight? Remember, our team wants to do these because we want to be transparent, accessible, available to you in COVID or out of COVID. And God willing, we'll be together in some big auditorium at some point. But until we can do that, we want to continue doing things like this. So thank you so much to them, these beautiful community television stations. Thank you so much to Nicholas and Allison, who have been interpreting the entire evening simultaneously in Spanish. And thank you to Caitlin for closed captioning. We're going to push all of this out, so we'll have a transcript in English, and we'll have the video, and it'll of course also be on our community cable stations. And with that, I am, and Elena is nicely posting all kinds of different numbers and emails and links you can use to sign up on Facebook, on Twitter, on Instagram. And let me say, I am on Facebook and on Twitter, but I don't understand Instagram. So that's Cameron. So if you're on Instagram, you're getting Cameron, but he's wonderful. And our State House office, our district office, our website. And our website is a place we invest a lot in, thanks to Sam Hopper. And with that, my friends, I am going to wish you good night. Thank my team. Thank everybody for coming. It is an honor to do this work. We want to do it better. And so your feedback helps make us better. So with that, everybody, good night and be well.